Hey moms, welcome back to Mom and Tummy Fix. I'm Camille, and today we're talking about something super important that I think every mom needs to know about and oftentimes doesn't know about, and that is diastasis recti, or abs separation. And these are the top 5 symptoms that might be telling you this is something that you have. Now, maybe you're thinking, diastasis what? Like, what is that? Like, don't worry, I've got you. Diastasis recti is when the muscles in your abdomen, specifically those 6-pack muscles, separate during pregnancy to make room for your growing baby. Everybody has these 6-pack muscles. Usually they're together as your baby grows, they separate, and the separation is totally normal. In fact, it does happen to 100% of pregnant women, but for some moms, actually 1/3 all moms. These muscles don't come back together fully on their own after you give birth. So that's when things can become a problem, is when those muscles don't come back together. And so why is this important? Well, if it's left untreated, diastasis recti can lead to a bunch of other problems, like low back pain, poor posture, pelvic pain, hip pain, weakness, even hernias. But here's the thing. Most doctors don't check for it after you have a baby. And so that's why I am on a mission to help moms take their health into their own hands and be their own advocate. So let's talk about those top 5 symptoms of diastasis recti that every mom needs to know about. Symptom number 1. First, you might still look pregnant, even months or years after you've had your last baby. And if your tummy is still sticking out, if you have kids that are asking, oh, when's the next baby coming? Like mine did. And even though you're eating well and exercising and that tummy just doesn't seem to go away, this could be a sign of diastasis recti. It's not extra baby weight. It's just that your muscles haven't come back together yet. And so it gives you the appearance of this pooch, or what's sometimes known as a mom pooch or a mommy tummy. It could actually be diastasis recti. Symptom number 2, this is called coning or doming. This happens when you contract your ab muscles, like when you're trying to do crunches or a sit-up, or even when you're just getting up out of bed and you see kind of this little peak or this dome shape that's popping up along the middle of your belly. That's your body's way of telling you that those muscles are actually still separated, and it's probably diastasis recti. Symptom number 3, something to look for, is softness or jelly-like feeling around your belly button. And I'm not talking about extra skin or loose skin after having a baby, or maybe some extra fat. I'm talking about even deeper than that. If you push in around your belly button, and if it feels kind of squishy or maybe even a little bit jelly-like, it's a clue that your muscles haven't connected as they should. And maybe it's not as firm in there as it should be or as it could be. It's like the muscles are too far apart to give you that tight, supportive feeling that's in your core. And that is a huge sign of diastasis recti. All right, symptom number 4. This one is a biggie. Low back pain, pelvic pain, or even hip pain. So when your core isn't functioning properly because of diastasis recti, it can put a lot of extra stress on your back, on your pelvis, on your hips, because your core is actually made up of 29 different muscles. So all these muscles that help move, help support, and help stabilize your spine. And so that includes your pelvis, that includes your lower back, that includes your hips, it includes your stomach. It's way more than the 6-pack that we focus on, than our abs that we think, oh, I gotta get my abs back. It's like, no, actually, we gotta strengthen your whole core. So many times when Dr. Jared treats people in his clinic for low back pain, it's actually because they have a weak core. That's where that low back pain is coming from. And many times, it's because of untreated diastasis recti. So if you are experiencing low back pain that just doesn't seem to go away, or you have like pelvic pain or even hip pain deep inside, it might be time to check if diastasis recti is the cause. All right, symptom number 5. Let's talk about something that's not super fun, but it's really important because so many moms experience this, and that is leaking urine when you jump, when you run, when you cough, or when you sneeze. And this happens because diastasis recti can actually weaken your pelvic floor muscles, which support your bladder. Isn't it crazy how much is all connected to your core? It's so much more than abs. It is everything going on in this whole part of your body. So if you're finding yourself having a little leak during these activities, it could totally be connected to diastasis recti. All right, so there you have it, the top 5 symptoms of diastasis recti that every mom should know. And if you recognize any of these signs going on in your body, don't worry, you are not alone. Like I said, 1/3 of all women have diastasis recti 1 year after having a baby. Their body just doesn't close their ab muscles on their own. And here's the thing, there's so much that you can do to help your body heal. And that's what our whole channel is about. So if you want a 60-second test to test on yourself and to see if you have diastasis recti, I'll link to that right here. And if you want to try a core workout that heals diastasis recti, try this one. And of course, be sure to subscribe to the Mom to Pooch channel, where we will be sharing more tips, more exercises, and more support to help you feel strong and confident as a mom. So thanks for watching. We'll see you next time.